Are you worrying about your up-and-coming OSCE exams? Do you feel the pandemic has hindered your progress? Feel you haven't practiced enough? Well, don't worry, because today I will be sharing with you 10 tips to not only pass your OSCEs, but to smash them. Have your notepad or your tablet ready to take notes. Hi everyone, and welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. If you are new and you haven't subscribed, then why not take a minute to hit the subscribe button, because I have loads of useful content to support you on your medical career journey. As always, if you enjoyed the video and gained value from it, then give it a thumbs up. So this video is a compilation of tips from my own personal experience when I was preparing for OSCEs and what people have ultimately shared with me. And I'm also an examiner for Queen Mary University London, so I've examined many medical students and I'm due to examine again this coming year. And so I'll be sharing with you some of the common mistakes that I've seen when I've been examining medical students like yourself. So let's get into the video. Tip number 1, be confident, even if you don't feel that you are. But honestly, you are probably more knowledgeable than you think you are. As medics, we often doubt ourselves, we often feel we could do better, and that can hinder our progress. So start off by having confidence, because there is a big difference between a candidate who comes into the station appearing confident compared to a candidate who comes in looking like they think they shouldn't be there and they haven't prepared enough. Now, if you come into a station looking confident, appearing like you're ready to take on this exam, then you are more likely to pass. There's a little story here. When I was studying, a consultant said to me that when he was examining a group of medical students, there was one medical student who told him a story about this particular research in answer to a question he'd asked at the end of the OSCE exam. And the consultant hadn't heard of this research, and so he was really impressed and he passed the student. Anyway, later on, he looked into what the student had said and he realized that it was complete and utter rubbish. But what the consultant had said to me was the candidate came across very, very confident, and so he was really impressed and he passed the student. Now, I'm not saying to lie, and that's exactly what I'm not saying. But you can see here how being confident can actually really increase your chances of passing your exams. Ultimately, when you walk into a station, you want to give a very good impression. And so having confidence will enable you to do that. Now, along with being confident, and even something that can help you be confident, is looking smart, dressing smart. That will boost your confidence automatically and make you feel good. Even if you are sitting remote exams, get dressed, look smart, and make sure you smash that exam. Tip number 2 is practice, practice, and more practice. Now, the more you practice, the more confident you'll become. So this feeds into the point above. I can't emphasize practicing enough, and it's even more important than written exams to practice for practical exams. You don't want to go into a station thinking about the next steps in an examination. You don't want to be looking unsure. I want to see a candidate who looks like they've practiced that exam 100 times or more. I want to see a candidate who looks like they've been at the bedside, they've had some bedside teaching, they've examined some patients, and they know what they're doing. It's so important to practice as much as you can for your practical exams, because you're under more pressure in a sense. Well, for most people, you're being observed. You may have to think on your feet to present and to answer any questions. So if you practice loads, you'll be in such a better position than if you haven't invested that time to practice as much as you could have. Tip number 3, do not work alone. This goes for most of your revision, really. There are of course things you kind of have to do on your own, but for the most part throughout medical school, I would really encourage you to work in groups, work with at least one other person. For example, you can divide the work, which actually helps you with your time management and managing the workload that you have at medical school. So you can learn something and your peer can learn something else, and then you teach each other. I would say it is very difficult to practice for an OSCE exam by yourself. You can do that, of course, if you have to and you have no other choice, or in a couple of days before the exam, then of course you can practice by yourself. But for the most part, you need to practice in groups. This is the best way to ensure you are going to pass really well in your OSCE exams. So groups of 3 or 4 where you can have an observer giving some feedback, written or just verbal feedback, are probably the group sizes that I would recommend. Of course you can do it in 2s, but having an observer does add another layer to your revision. One thing I will say here is don't be too nice to each other. Give constructive feedback. You're not going to improve and you're not going to do your friends any favors if you do not give them constructive feedback. I'm not saying be horrible, but give them some tips so that they can ultimately improve and get better. Tip 4, speak up and speak clearly. Often I have encountered candidates who I can't really hear, you know, and this means that it's hard then for me to give the candidate marks. So make sure you speak up, that's number 1, and speak clearly. Again, there have been candidates who I've not understood. I'm not really meant to speak to you in the station and I'm not going to keep asking you to repeat yourself. So make sure that you are clear when you speak. Of course, if you've got a strong accent, then it may be difficult for people to understand you. But this is where, like the above point, practice comes in so handy. If you practice, if you know there are certain words that are a struggle for you to pronounce or a struggle for people to understand, then try and work on that. Of course, there's only so much you can do, but if you're aware of something, then you can try and adjust as needed. Tip 5, be polite and professional at all times, in all exams, in all circumstances. This is where being observed is really important. There may be things that you don't even know that you're doing that may come across in the wrong way, and so your peer can tell you about this and you can adjust accordingly. Now, of course, if you're nervous, then you may say something that you shouldn't have. Of course, apologize where you need to. Always be polite and professional to the actor who is ultimately playing a patient. So don't see them as an actor, see them as a patient. And be gentle with the actors or patients. I have seen a few candidates who, of course, not intentionally, have been a little bit rough with the actor or the patient. Be conscious, be as gentle as you can, and tell the actor what you're going to be doing. So be polite, be professional from the moment your exam starts to right at the end. And of course, it goes beyond exams. Tip number 6 is read the question carefully. Now, it may seem obvious, but when you're nervous and you're flustered and you have no idea what they want you to do in this station, this is where you may not read and pick up key words. So yes, you're going to be nervous, but take your time, take a few deep breaths, read the blurb. It's often not that much. It may seem like it is a lot, but it's usually a few paragraphs or one paragraph. And what I would say to you is pick out some key terms, and then you should be able to puzzle together what it is that they want you to do in the station. I have seen many candidates rush, not read the information properly, and then they go down the wrong path completely. There's not much I can do to help. I'm not meant to, as an examiner, speak to a candidate. So if you read the information incorrectly and you go down the wrong path, then you're going to fail that station. Of course, with practice, there are some stations that you will know exactly what they want you to do without even reading the blurb. But of course, always read the blurb. This could be for cannulation or an ABG. You'll see an arm, and so it's pretty obvious that it's going to be some clinical skills. Now, tip number 7, don't speak to me as an examiner. Of course, we may have to speak at some point throughout the examination, but in general, don't speak to me. I'm there to observe you. I'm not there to coach you. I'm not teaching you at that point. You've had all your teaching. It's time to show me what you can do. I have many candidates who come to me and ask me, should I do this? Should I do that? I can't really help you. It's not being harsh, it's an exam. So don't speak to the examiner. The only time you should really speak to the examiner is when you're telling them what you're doing, like you're telling them what you're doing for an examination or during an examination, or you're presenting to the examiner, or you're answering questions. So sometimes there will be questions at the end of an exam, and so that's when you speak to the examiner. But other than that, don't speak to the examiner, pretend they're not there, and just converse with them when you need to highlight something and you need to tell them exactly what you're doing. So just to be really specific, don't ask the examiner questions, but like I said, you can tell them exactly what you're doing if it's not always clear and what you're looking for, and so on and so forth. So the next two tips will be talking through what you should or what you must do, and then what you mustn't do. So tip number 8 is what you should do. So make sure you always do the basics. So this can include things like basic hygiene. So when you come into a station or before you get into a station, wash your hands and show the examiner you are washing your hands. Don't just take a little bit of alcohol gel and then just quickly rub it together in your hands. Show them the steps of hand washing. So when I was at UCL, I was taught the mnemonic wiper. But yes, always wash your hands. There will always be some alcohol gel for you to demonstrate hand washing. And of course, if something's not there, then don't waste time looking for it. Like if the alcohol gel is not there, then just say you'd wash your hands, or just do it, do the motions, do the steps. Please don't waste time. I'm not interested if the alcohol gel's missing, and I know you know it's missing, but just wash your hands. Always introduce yourself. I don't know who you are. The patient doesn't know who you are. Yes, in some cases you show your badge, but you always introduce yourself. Always ask for consent. You can mention confidentiality, of course, depending on the station. You can just do that as part of your introduction. You should always, always, always look around the bedside and make it obvious to me as an examiner that you're looking around the bedside or that you're looking for things. Don't just dive in and examine the patient. So do a general inspection and then go closer to the patient and do an inspection of the patient. How do they look? Do they look like they're in pain? And also, before you touch the patient, ask if they're in pain. For example, if you're examining the abdomen and the patient says that they've got pain on the left side, then you start on the right side of the abdomen. So asking questions like that are really important to demonstrate to me as an examiner that you know what you're doing and that you're safe. And like I said above, I've seen many candidates who may not obviously want to hurt the actor, but they have come close to doing that because they've been a little bit too rough. So be very mindful that the actor is human and that they hurt too. So be careful, be very gentle, be as gentle as you can. And like I said, communicate with the actor, tell them what you're going to do so that they're prepared and that they feel a bit more comfortable and at ease. Tip number 9, what you shouldn't do. So if you've asked for consent to take a history or to examine, there's no reason to keep asking for consent throughout the examination or throughout the history taking station. I've seen many candidates who will say, oh, can I ask? May I ask? You've already gained consent to speak to that person, so please don't waste time asking again if it's okay to ask a particular question. There's a difference between signposting or explaining to a patient that you're going to be asking sensitive questions. That's different. But please don't waste time, like I said, asking for permission over and over again. Don't make inappropriate comments and don't laugh inappropriately. Look, I'm guilty of this. Sometimes I laugh when I'm nervous. But try and hold this back if you can. When I was in my exam, I don't think I ever laughed inappropriately. I think I just got into the zone and I just did what I had to do. But of course, there are many people who may find it difficult to kind of control any inappropriate laughter or nervous laughter. So if you know you're one of those people, this is where practice comes into it again. Try and work on that. Try and put yourself maybe in more uncomfortable situations so that you can then work on this, and then over time hopefully you should be able to get better at controlling these kind of nervous behaviors. And of course, like I said above, do not be rude, be polite at all times, and do not use sarcasm. What I will say in relation to the point above, you shouldn't carry on if you feel you're going down the wrong path. If it becomes clear to you midway through the station that you're going down the wrong path and the examiner hasn't highlighted that to you, then stop and use what remaining time that you have to rectify things. You can still get points for that rather than carrying on. No. Stop, realize what you've done wrong, try and rectify it, because you can still salvage the station and pass that station. Lastly, do not continue if you do not feel well or you feel that something is wrong. So please don't carry on if you feel that you're not well. Get some help. They can make exceptions in some circumstances. In some cases, I'm sure you'll be able to do that station over, or if not, the exam over. Tip number 10 is how to stand out from the crowd. This was something that I was asked to talk about. There are many things in which you can do to stand out. Like I said already, being confident helps massively. So that's something that you can do, which is something that, like I said, comes with practice and experience, but it can be done. What I would say is to just be you. I really enjoy seeing candidates who don't let the nerves overtake them. Even though it's a stressful and nervous or nerve-wracking situation, they still allow, or they're still able to bring some of their personality through to the exam. I like to see a candidate who smiles, a candidate who looks or even just appears relaxed. That fills me with confidence in them, knowing that they're going to be a safe and competent doctor. So be you. If you can, let some of your personality shine through and try and enjoy the exam. Second tip here is knowing your stuff. It's always good to see a candidate who knows exactly what they're doing. They don't stop and start. They do the examination very smoothly and without many hiccups. Use the exam as your time to show the examiner that you've done the hard work, you know what you're doing, and that you're capable of looking after patients. You're capable of being a safe and competent doctor. Third thing, not panicking when something goes wrong. Of course, it may be in your nature to be a bit more of a panicker, but you need to work on this, because as doctors, we're under, immense pressure day in, day out. Some areas and specialties more than others, but as a whole, medics are usually under pressure. So it's really important that if something goes wrong or you're not sure what to do, that you don't panic. You can't think if you're panicking. You need to take some deep breaths and you need to work on this. I would urge you to work on this as much as possible. If you know that you're this type of person. It's good to see someone who looks like they actually care about the patient and they're actually very genuine. Try and think that I'm the doctor, or I'm a medical student, very competent, and I'm here to speak to a patient, or I'm here to examine a patient. Finally, like I said, if something goes wrong, there are many staff members who are there to help, so please don't suffer in silence. And please try and remember that as examiners, we want you to pass. And you have to have a really, really good reason to fail someone. Someone has to be really, really awful for them to fail. So I'm sure many of you out there are doing really, really well and are very competent and are going to go on to be competent, safe, lovely doctors. So just remember that. Remember, we want you to pass. Give us a smile. We are human too. And like I said, we want the best for you. I hope that helps. All the best for your up and coming exams. And as always, if you found value in the video, then give it a thumbs up. And let me know in the comment section below if you're due to have your exams, how you're feeling, and if you've had them already, how you did or how you feel that they went. I will see you in my next video.